I'm Dr. Cilla, and I'm the sedation dentist in our practice. My partner does the hard work. I just sedate you. In a population of 300 million people in the United States, 30% are dental phobics. In other words, there are 90 million people in the United States that are afraid to go to the dentist. So don't feel like you're the Lone Ranger. You're not. Also, almost everyone that comes in for sedation needs a lot of work, and they're all very embarrassed that their mouth has gotten in the condition it's in. But you shouldn't be embarrassed. It's dentistry's fault. We haven't helped you in the past. Today, you've got all the help you need. You can have sleep dentistry. You can use either pills, for one type, that's oral sedation, or we can use intravenous, that's a needle in your arm, just like when your doctor draws blood to do lab work. We insert a needle and then run the sedation solution until you're done. One of the nice things about sedation is when we're done, you don't remember anything. That's called anterograde amnesia. It's really nice to go to the dentist, have all of this work done that you thought you could never get done, root canals, extractions, implants, everything that you need we can do, and later you don't even remember it. You go home, you sleep on the way home, somebody must give you a ride, and then generally you go home and you lay down and take a nap for a couple hours. You wake up, you feel pretty refreshed. Very seldom do you have pain, but we take care of that. We give you medication that if there is pain, not to worry, it isn't going to last very long. What's it like? What do we do with this sedation? How do we know what we're going to do? You come in, we take x-rays, we do an examination, we decide what can be done, and we make you you're part of the deal, because you have to say what you do want done. Everyone doesn't want to save every tooth. Some of you want to save every tooth, and you make us work, but you know what? In the end result, that's what we do for a living. That's what we do for people. If you will, then you will have a choice of what to do, and you're given an estimate. You're given this estimate, then you can make decisions and decide what you're going to have done, when you're going to have it done, how you're going to have it done. Sedation dentistry really, really works for the people that are frightened. We've had people come in here. One lady I remember, her family had an intervention. They made her go to the dentist. So I asked, and this is when we were using pills. And I asked her, I said, "Now, you probably don't think we can help you, do you?" She said, "I know you can't." I said, "Tell you what, we're going to do one free sedation and just take out one tooth." Well, her mouth, she didn't smile, by the way, when she came in. And when she opened her mouth, I saw why. She didn't have one whole tooth in her mouth. This was a lady about 52 years of age. So we got her in, we sedated her with pills, and it was so bad that I couldn't just take out one. I had to take out three. So she came later, then she came out of the sedation. We sent her home with her husband, and she came back for post-op check a week later. I said, "Well, what do you think?" She said, "Let's get going. Let's do it all." And so we did do it all in 2 appointments. She had all of her teeth removed, the arch, the gums they were taken care of so that it was healthy, and then we made dentures for her. She turned out to be a very, very happy person. As a matter of fact, I was always struck with then how she smiled, how much she smiled. Before that, I'm telling you, this lady was not much of a smiler. It was very interesting because later it turned out she was still mad at her family because they made her come in. But she turned out to be great. But we have many, many patients like that. If you're like that, you're embarrassed, don't be. We're here to help you. We're not here to judge you. We're here to take care of you and be part of your health team. You know, when a person has decided that they don't want something done, we don't overcome them. It's totally 100% their choice. We tell them what can be done for their mouth. We tell them how much it's going to cost. We tell them how we do things. And then they make that decision. You're not forced into anything. And this is just done with no charge. For the x-rays, there's a charge. But you as a patient make the decision what to do. All we're here to do is help you. We're not here to force anyone to do anything.